In my work, we use a number of different strategies. One of the strategies that we use is the story dialogue method. So using stories to teach sexual health education. So if you want to talk about contraception, for instance, instead of just talking about the list of the different methods of contraception, putting it in a story gives people a realistic picture of what you want to say. Okay, so we have different stories for different audiences. So if you're working with young people, a story around STIs or safe partying combined with STIs is another good storyline to use. So picking up on the key themes, you got to a party, a couple of months later you realize that you're feeling itchy. What would you do? Who would you tell, or who would you go to for more help? So giving the young person clear steps on, okay, if you've had unprotected sex, if after a couple of months or after a couple of weeks you feel that I've got a bit of discomfort, what is the next step that you can take? Who could you go to for help? So one of the things that I would say is if you've got a culturally diverse class, make sure that whatever strategy you're using also uses simple things like names from different cultures. So don't stick to names that are just common to you, but try and find out in your class what other cultures call other things, and look for stories that also suit the different cultures. So ask people about dating in their own cultures, about relationships in their own cultures. That will actually give you a place of comfort to begin your sexuality education. I think one of the things that I found helpful as a sexual health educator is in some groups being open and acknowledging that while some might not know everything from every culture, it's a sharing experience. So encourage the audience to tell you, this is what we say about relationships or sexuality in Australia. How is it different from where you're coming from? And that engages the audience in the conversation. So the most common example I give is if the school is sending a young person, 14 or 15, with a letter home saying we're going to have a sexuality class or sexuality education, it's giving the young person a lot of responsibility to go to the parents and say, I actually want to learn about sex. So I would say to teachers, find ways to make the process easier for students. Could it be that if you've got a cultural liaison person at the school, get them to organize some information or invest in translating a letter that goes to the parents so that the responsibility is not on your student but is on the school or is on you as the teacher to get that information out. Passing on a letter, if I put myself in a 14-year-old's position, if I was 14 and learning in Australia, I wouldn't take the letter home because that would lead to my parents asking me a lot of questions. And in addition, I would have to translate the letter into my first language. So that would make it very difficult because some of the words that are simple in English, like sexuality, are not easy to translate into another language. So it's a lot of responsibility that we usually just hand down to a student. So I would say if I was a student, I wouldn't take it home, and I assume a lot of them would do the same. I know that teachers are bombarded with a lot of training and information around how best to work with students from a different range of backgrounds. But I think the most important thing that I would urge is if you're working with interpreters, always ensure that the interpreter is briefed before the class on the information that you're going to be giving. And given that sexual health and sexuality education is a sensitive topic, it might be that is the only session you actually bring in an interpreter to make sure your message is communicated correctly and you're getting the questions that the students have correctly as well.